So this is a great question if you can actually stop opioid withdrawal with over-the-counter medicines. So first of all, what is opioid withdrawal? This is this terrible feeling that people who use opioids long-term get when they stop using opioids. I've heard it described as flu times 1,000, or maybe these days you'd say COVID times 1,000. But it's really uncomfortable because you've actually got opioid receptors throughout your body, and so you can have diarrhea, nausea, vomiting, sweating, this just terrible body aches, muscle spasms. It really is a terrible feeling that people get. Some of the over-the-counter medications that have been tried are things like anti-inflammatory medicines like ibuprofen, Advil, Motrin as examples. There's also medicines for diarrhea, like one's called loperamide or Imodium, which is available over the counter. But we've actually found that these over-the-counter medications don't really do the trick. In fact, with Bicycle Health, if you're presenting with opioid withdrawal, we often will prescribe additional medications which will help you get through the withdrawal. Some examples are a medicine that's called Zofran or ondansetron, which helps very well for nausea and vomiting. And another one's called tizanidine, which helps with the muscle spasms that you might feel. But really, the true treatment is to treat the underlying problem. And I've done this. I'm an emergency physician by training, and for many, many years, we just treat opioid withdrawal with these symptomatic medications, and it just didn't work. So the way you really treat withdrawal is by addressing the root of the problem, and that's commonly by using a medication which treats the opioid receptor withdrawal, and that's with buprenorphine or Suboxone. With Bicycle Health, we would start you on Suboxone if you're an appropriate candidate. We start it at the right dose and the right timing so you can get out of withdrawal, and that usually gets you back to living a normal life without the need for other medications.